We're here at BAYOU on the BAYOU. I'm Carolyn Schofield, Assistant Director of Marketing and Communications at Tulane University School of Medicine. And right now I've got Elaine Hamm. I know you by one title, but give me all of the titles.
All the titles. These can only last so long. I don't want to go over time, but when my role at Tulane, I am the executive in residence for the School of Medicine. But before all of that, I've actually been in the startup world for many years, and I manage a portfolio of early stage drug development companies, one of which I'm here to talk about today. It's a company that I started a few years ago, and it's called Cadenza Bio. So I'm very excited to talk about it today.
What's the focus of that company?
So the focus, it's been ever changing, to be honest. So I started it with a friend of mine, Dr. Carol Curtis. She was on the investment side many years ago in a company that I worked for. She invested in my company. And so after she left the venture capital world, we wanted to start a company together. So we were looking for technologies that really kind of spoke to us, things that we thought could be transformational. And we started out focused on a series of compounds that were for the treatment of multiple sclerosis specifically. And what these drugs did was focus on an aspect of MS that we don't often talk about, which is remyelination. So the MS drug is really interesting in the sense that it addresses an aspect of MS that most of the drugs out there, when I first saw this technology, is like, there's drugs for MS. What do we need another one for? It's because they don't work very well. They sort of just delay the inevitability of the debilitating aspects of MS. But at the same time, we realized that we had another set of compounds that was focused on endometriosis. And we saw that we had some studies done at the University of Illinois on mice on endometriosis, and that really changed how we thought about Cadenza. So with Cadenza, we ended up becoming a women's health company. MS disproportionately actually impacts women more than it does men, about 3 times more likely to have MS. And then endometriosis, obviously, a very women's health-focused disease. And so we have kind of shifted over the past few years of becoming a women's health company. So,
how important is it to focus on women's health? It seems like traditionally that's been kind of ignored.
Girl, don't get me started. It's massively, people don't think about it too often. Women do. But as an industry, it's something that we really haven't focused on. And for many, many reasons. One, there's just not a lot of research dollars as it relates to women's health. There's lots of, NCI funding for cancer, but there's not really an NWI of focus on women's health. And so there's just a lack of understanding of basic physiological processes in women. One thing that I really like about Tulane is that we actually have sex-based medicine as a big focus here. And so that's becoming such a big aspect within medicine of understanding that you can't just do clinical trials in white men. You have to go beyond that because it has to reflect the population. And I'm pleased to see in the past, I've been doing this for over 15 years. In the past probably 3 years, I've seen a bigger emphasis on women's health and diseases that primarily affect women. And not just, when I say emphasis, it's not just the research piece of it. We're also seeing pharma and we're seeing investors very interested in looking at women's health as an opportunity from a market perspective, which is a big shift. So,
has there been much focus on endometriosis in the past?
No. And I think honestly, as an indication, we're still trying to understand it, and women aren't really talking about it that much either. So I actually had endometriosis. I didn't know it until I was in my 30s and I had a surgery. Then I figured out I have endometriosis. That's what this problem has been all along. But for 10 years, I thought, this is my normal. And with endometriosis, there's a number of different symptoms: infertility, there's issues with pain. Pain's a big aspect of it. I thought, you missed work all the time for, your period, but it turns out the level of pain can be pretty debilitating for women. I thought my appendicitis was actually my period because that's how painful it is. But women aren't really talking about that either. And I feel like there's been a shift of women talking about their problems and their issues. So That's, I think, that's an exciting part of the women's health story, is that more people are talking about it, including women. So that was a missing piece.
Now, this community and conferences like this are all about connection. So
Absolutely.
what kind of resources are you looking for right now? What help can you?
Well, I'm an entrepreneur. We're always raising money. So I mean, I think every time I come here, I'm probably raising some kind of round of funding. But we've Cadenza Bio actually raised a round of funding back in December, a nice seed round to move our MS program to a certain stage, and then build up our endometriosis program. So I'm very excited about that. But now we're ready to scale up. We've hit all of our milestones, so that's always good. And we're ready to move on to our Series A. And so I think really it's finding, obviously, investors that are interested in moving, diversifying their investments into women's health. And I also think that it's reaching out to patients and women and the community to understand, that the patient advocacy piece is a really important piece of any disease story, but especially as we start focusing on women's health, we need more voices. And so my ask, always money, but also to really hear from patients and people that have been affected by MS as well as endometriosis.
I think a lot of people are not afraid, but uncomfortable to talk about their medical issues,
know.
and probably women in particular.
We're the worst about it. I mean, and it's hard, but here's the thing. Of course, I have a PhD in poop, so my bar is low of what I'm willing to talk about. So, I mean, I think that, just important to have these conversations. I mean, to talk about my period on an interview. I mean, that's part of it, right? And I'm just we have to get comfortable about talking about these things. Otherwise, it's just going to continue to get sort of pushed to the side because we're too embarrassed about it. But hey, it's just life.
Is there anything else you want to say?
No, I think that's it. I just want to thank everyone for taking time to listen to me. That's always great. But also for attending BAYOU on the BAYOU. We're really excited about this year's conference. Very excited to have Don Davis helping us promote this and the important entrepreneurs in this community. So we're excited for next year too.